Yeah, well, my thesis about preventive health starts with women, and I said a couple of words about this morning already, that women are the primary care deliverers all over the world, regardless of the development status of the country. They're the ones who look at their children, they look at their men, they look at the other people in their workforce, they're in their community, and they're aware of things that are not going right. So they're usually the person that everybody goes to. The child goes to mom and says, look, I broke my whatever, and the husband comes in and says, I never should be allowed to work today, and so forth. They're usually the first ones to hear about these things. So they are really the ones we need to concentrate on. Furthermore, and I find this terribly important, women talk to each other. When you have a room full of women and you've given them something to know about their own health, the next thing you know, they're talking to each other about it. Then they're talking to other women about it. Men don't do this. I don't know why they don't, but they don't. And the women become a kind of a whole message center for the class of women, the group that they're working with or socializing with at all times, and these things get reinforced. And I have a very, very interesting story about this. The Thailand program in respect to AIDS has been very successful. To deal with that some other time. But they have a problem in what's known as the elephant's trunk, the portion of Thailand that goes down way south from where the country major part of it is. And the population is about half and half Muslim and non-Muslim. Well, the program that we initiated there, I should say one of our students did, to tell the women about family planning, literally eliminated the Muslims. We didn't even invite them. But over time, it was extraordinary what happened. When you tested the Muslim women, they are right with the non-Muslim wisdom and learning the lessons that we were teaching. In other words, behind the house, over the back fence, God knows how, they were listening and their ears were perked way up. So you can't assume that this coconut wireless, or whatever you want to call it, is inoperative. It can be very important. Okay, in talking about women's health, it's important to realize that there are 5 very basic elements of a woman's life, and in each one of those elements, her health needs are different. And I'm not going to go into these things in any particular depth. I'll just let it come out as it goes along. This is conversation now. The whole process starts with childhood. Childhood is before women begin to menstruate. So menstruation is really the controlling factor from the time it begins, which in some languages is called menarche, and in others this is called the womanhood, and God knows what. There's sometimes a celebration. In parts of West Africa, they still do infantibulation, which is the mutilation of a girl's genitals at that time, so she won't ever enjoy sex or something like that. Terrible thing. But there are these markers. Once the woman, and that's what she needs to be called now, can menstruate, she goes into a phase that we might just as well call pre-pregnant, because that is the status that requires the first real changes in her health approach. Childhood, we're concerned about growth. So what the girl eats and does is very important for all the steps that follow on. So childhood is the first major item in a woman's list of reproductive health. Once she passes menarche and begins to menstruate, she is pre-pregnant. We've had satisfactory normal deliveries from 9-year-old girls in Hawaii, and I'm sure this happens elsewhere. But normally, childbearing age is considered to be 15 through 39. So the World Health Organization, all the statistical generators are dealing with childbearing age And when it comes to the delivery of preventive care, women of childbearing age are the ones you need to focus on. Those are the years during which they bear children. Those are the years in which they are likely to start behaviors or diseases that will cause a lot of trouble later on. You can't ignore a population group. And nominally, it's about half the population. It doesn't start out that way, but it ends up as approximately that. And it's very important to know who they are and where they are, because your programs are going to be aimed at them. In other words, the number of people you expect, the number of people that you have to attract, the number of people you have to teach in language that they can share with each other, and so on and so forth, all start with women of childbearing age, sometimes abbreviated WCBA. Okay, women of childbearing age cannot escape the basic fact that women are baby factories. That's what evolution has made them to be, and that is what everything they do is somehow focused on. The complexity of childbearing is absolutely beyond our ken at this point. We don't know everything about it, but it does all sorts of things, from making good body parts that work down to making antibodies that produce benefits to the breastfed child, etc. The complexity is enormous. So what we have to do is deal with women's health. So this, you might say, would be the first of a series of public health programs we need to deal generally with women's health. And women's health is dominated by the reproductive cycle. Once they become pre-pregnant, the next phase is, within that status, pregnant. And when a woman becomes pregnant, her whole attitudes towards the health of the baby becomes increasingly dominant, but it becomes important from the very beginning. The major body parts made by a fetus are all generated within the first 3 months. So that's the time when she has to be particularly careful about what goes into her bloodstream. She always will have to be careful, but that is a very special time. Beyond that, her overall health has to be observed. She has to watch out for weight gain, not only because it can be dangerous to the fetus and to the children born by that fetus in later generations, but because it is going to be a determinant in cardiovascular diseases that come later. Watching that weight gain during pregnancy is vital. Other things that can happen, for example, you have the kind of diabetes that comes on during pregnancy, which is sometimes temporary and goes away automatically as soon as delivery takes place. But every time the woman gets pregnant, the temptation of her body to become diabetic increases. And in the end, and in some cases in the very first time, it doesn't go away. This generational type of diabetes is a thing to watch out for. Furthermore, there's the whole process of delivery, which is a very, very tricky thing. This fetus, which has been essentially a fish, living in its own little watery world, makes the transition to a air-breathing mammal, and it will do it over a matter of minutes. This is as near to a miracle as anything you can imagine, but it affects both mother and child. There are things that happen during pregnancy, or I should say during delivery, that are distinctly disadvantageous. And a lot of the woman's behavior as she approaches the time of delivery is governed almost minute by minute by the requirements of staying in one place with respect to her health status. So that's great. Once the woman has delivered, she has a major job of returning to her daily life. And step one is to get rid of the extra weight that she put on during the pregnancy process. So her health is then governed by postpartum behavior. And finally, when this whole menstruation thing comes to an end, we go into her last years, the menopause, menstruation pauses permanently after she starts. And from then on, her role with respect to health is increased. As a grandmother, she has a lot to say about the newborn baby. And as one of the senior women, she has a lot to say about the health of the family, the community, and so on. In California, back in the 70s, we found that senior women in the migrant workers' camps were the nearest thing to the formal delivery of medicine. They had all kinds of nostrums, some of them very valid, but they were watching the health of the community, and they were the ones that the younger people went to when something went wrong. So a woman has to watch out for her health at every age, and the importance of the women's basic health program should focus on that at every point. The other major portions that I'm not going to talk about now are family planning, the spacing of babies in the interest of the health of the baby and in the health of the mother at time of delivery. The well baby, the newborn child needs special attention. Infant mortality is a measure of this. We won't even talk about newborn mortality in places like Nigeria, but we should be talking about infant mortality, because infant mortality, while it only lasts for the first, after 28 days till the first baby, till the first birthday, that is the infant period. The first 28 days are the newborn, and each of them has a separate way of getting unhealthy. The children, as they approach age 1, are beginning to stick their fingers into light sockets and that sort of stuff, and so they need to be protected physically. For the first few days of life, the best thing mother can do is breastfeed, because her breastfeeding passes on all her health history and all the preventive activities that have generated in her body and so on. It's absolutely, I'd say that's the second miracle in this whole process. And finally, once the woman is delivered, she has to watch out for her own health. So that can be, I should point this out, that at every one of these episodes, when you're preaching preventive care, you're also telling the woman what she needs to do if somebody comes to her and says, what do I do about this? So all along the line, you're not only preaching to the potential victim, you're preaching to the teachers. And there is probably nothing better working in a developing situation to find yourself not teaching the man to fish, not teaching the man how to catch a fish, but how to teach fishing. And that's what we're doing here, all the way along the line. So, okay, we start out with childhood, which is the beginning of women's health. We move into family planning, which incidentally is where you start dealing with sexually transmitted diseases. And then the next step is infant health. And these things are the basic portions of your public health program. Men's health stems from this. The women are the primary carers. They're the ones who say to their husbands, if they're getting good at it, you got to cut down your drinking. You got to stop eating so much of that, whatever it is that everybody in this country eats too much of. You know, these are the things that make women's health so vital. So there you have your public health program. Whether your clinics are organized about this, or the whole program is organized around it, it becomes the fundamental of the entire health process.